So this poster here was developed by Dr. Bale and Amy Doneen, who actually I credit them with being our mentors as far as teaching us this approach. Is the Bale-Doneen method or methodology of heart attack, stroke, and diabetes prevention. But what it displays here is how much more there is other than just LDL. There are a lot of small dense particle types, VLDL, IDL, that are just as important and damaging, just like the LDL, but the LDL is the one that gets all the press because we've heard about that for years. There's also something called the HDL2B, they call it here the super cop. Think of it this way: your good cholesterol is the cleaning company, the one that cleans out the arterial system. HDL2B is the super cleaner, okay? So the way I always tell patients is if HDL is your cleaning crew, HDL2B is how many the cleaning company or cleaning people are actually working. You got to have all of them working. So it doesn't matter how many employees you have, they actually have to work. There's other risk factors involved too. LPA is a genetic type of LDL. All bets are off if you have this one. It's genetically inherited. Diet and exercise don't play a role in it, and it actually increases your risk for heart disease by 300%. So we want to know if we have that, and your traditional lipid test doesn't do that. Other markers are your LP-PLA2. It is the lipoprotein-associated phospholipase, a big fancy word for a plaque marker. But it was adopted as the most specific test to showing inflammation in the arterial wall and if your body's starting to make soft plaques. So we can actually tell how hot that arterial wall is and if you need some help. So basically what this is displaying is how LDL gets all the press, and we always work on getting LDL down, LDL down, LDL down, and we also have high triglycerides, a low good cholesterol, which actually is starting to become one of the higher risk factors for heart attack and stroke, and we don't address those. So even when we do address bad cholesterol, we still have other things we need to work on: obesity, high blood pressure, lack of sleep, multiple other risk factors. So with our advanced testing and what we can do here, we can identify these risks and kind of work on some of the underlying causes rather than just doing the standard of care. One thing about the standard of care is it's the standard of care. It's not optimal care, and so what we're trying to do here is actually practice optimal.